Hello, my name is Anna Lindenmayer, and this is my Shepherd Center interview for fieldwork in occupational therapy. So I'll take you through the questions. So a little bit about myself and how I decided to become an occupational therapist. So I'm a non-traditional, a bit of an older occupational therapy student. I graduated undergrad originally in 2010, so I've been out for quite a while. But I did do ROTC in college, so therefore I went into the Army for about 4.5 years, and then after that, I went and became a first grade teacher in New Orleans in the charter school system that's down there. So that has given me quite a lot of experience just in life. So yeah. And actually, it was when I was finishing up teaching, just after the pandemic, the big crazy part of the pandemic, I realized that teaching kind of wasn't necessarily for me. But I had always been interested in doing some sort of career in a place, that helped people. That was helping other people to thrive and do things. So I thought teaching that would help because, you're helping kids learn what they need to learn in order to be successful themselves. But just a lot of factors went into the decision to stop being a teacher. And while I was kind of ending my time, I did a couple of compatibility tests, personality tests, just did some sort of research onto other possible career paths, and I came across occupational therapy. Because on one of these compatibility tests, actually it ranked, you took the test, answered questions, and then it gave you a list from most compatible to least compatible. And for me, the most compatible were things like PT, OT, things like nursing. And as you kind of scrolled down the list, then it started to say college professor. And then you scrolled a little bit more down and it said engineering, and then it scrolled a little bit more down and then it said high school teacher. Continuing on down the list towards the bottom, it said middle school, and then pretty much right at the bottom it said elementary school, which was what I was doing, first grade. So I kind of realized that I needed to make a change, and I decided to look into occupational therapy. My mom was a director of career services at Western Connecticut University, and so she helped me kind of do a little bit of exploring of OT, and she helped me talk to different people who are in academia around healthcare, and so they were able to answer some questions, but I still don't think I knew exactly what OT was. And my whole entire life, I kind of stayed away from the sciences. But as I was taking the prerequisites for occupational therapy, all the occupational therapy schools that I was looking at going to, I found out that I really do enjoy the anatomy and physiology, the biology, the neurology, just things about the body I'm just absolutely fascinated by. So it was a really eye-opening experience, and occupational therapy seemed like a great career path to doing that, because a lot of people don't know what it is, but the more I've learned about it, the more endless the possibilities seem. So why am I pursuing a field work placement in neuro rehab at the Shepherd Center? So the opportunity to learn at a place like the Shepherd Center, which, nationally ranked, it doesn't come around very often. So the neuro rehab setting is one I'm particularly interested in exploring because of, my interest in just how the connection between the mind and the body, how that works, being able to help people who have had these traumatic experiences like spinal cord injuries or strokes or anything to do with the brain, traumatic brain injuries, is just something that's very interesting to me and something I think I want to do, especially, as a veteran. I used to see a lot of people going around with traumatic brain injuries or needing help in that aspect. And I think, maybe one of the interests that I am looking at is potentially looking to help fellow veterans with that. So, doing a lot of research, Shepherd Center seems to be one of the best places where you can get that best experience with it. So yeah, and it doesn't hurt that I have some uncles in Atlanta, so I would like to go back to Atlanta. All right, so the next is the scenarios. I've chosen scenario A. So what types of skills or interventions would you utilize when treating a patient with a C6 spinal cord injury who wants to be able to brush his teeth? So, yep, first step, I think, is to ensure that that's what he wants to do. Speak to the client, make sure that you are making up these goals together, and asking what type of level of independence he wants to do, and what he's functionally able to do. So there's a lot of things we could do. So some interventions that we can use are range of motion exercises, since the C6 spinal cord injury has limited mobility but not total loss of mobility. So it's important to keep what you have. The range of motion, also strengthening exercises, same thing. You don't lose total control, and if they want to be more independent, then it's extremely important that you work on that. Could use some adaptive equipment like adaptive toothbrush, where you can either stick on the wall that will stay there and you can just use, he can use his head and neck muscles, which he should be able to use. And I think being able to do the occupational analysis and seeing what the client is able to do versus what they want to do. And then you can do any task-specific training or any sort of education that needs to go on for that to happen. So next question. What areas of occupation do you think OTs address in an inpatient setting and an outpatient setting? In inpatient, I think that they do more of those ADLs, those kind of self-care occupations, like, taking care of yourself, brushing your teeth, like showering, those kinds of things that are kind of more in the person, within the person's body, and taking care of that. In an outpatient setting, I think it would be more the IADLs, more of those community occupations, things that the client participates and engages in the community and within their own homes, or in other places where outpatient is more able to reach that, because the clients do live at home, so they do need a different level of independence with that. So I think those IADLs can help the client participate in everyday life that they are actually in. So treating the occupation with occupation. Next question. Part of your fieldwork experience as a fieldwork student is receiving constructive feedback from your fieldwork educator regarding your treatment plans, documentation, and communication skills. How do you like to receive constructive feedback? Can you tell us about a time that you received constructive feedback and were able to use that feedback to improve your skills or performance? So, like I said before, I was a first grade teacher. And the coaching model that they had down there included a lot of what's called real-time coaching and some instant feedback. So what that looked like was we would teach, and our observer would be in the back of the classroom, and there would be kind of predetermined signals or signs to do a specific task or skill, either more or less. This predetermined kind of communication between you and your observer. And it did help you improve in the moment. It helped you kind of get those more visceral feelings of in the moment, what it feels like, and when you should respond to certain feelings or certain situations within the classroom. So that was really helpful for me to improve my teaching, and I really enjoyed that. So I do like feedback as close to the actual event as possible. That does help me a lot. And I don't mind getting feedback. I don't mind, fixing it immediately. I am action-oriented. I do like to try to fix things. So I appreciate feedback. So a time that I received constructive feedback, was able to use that feedback to improve, was just in teaching, but also when I was in the Army. I know when I first went into the Army as a military police officer, I don't think at that point I was as mature as I needed to be. And so I did get a talking to. There was a sergeant major who kind of took me aside and told me that I needed to stop just following other people. I needed to start improving myself. I needed to, kind of buck up and really do what was necessary to not just do the job, but, you always want to do better. So it was a lot about, my communication needed to improve, my work quality needed to improve. So what started happening after that, it took me a while. It wasn't an instant kind of impact. But what I did was I found a mentor within a couple months after that, who actually kind of told me the same thing. I needed to get myself together and wouldn't accept subpar work for me, even though I didn't like it at the time, but it helped me improve a lot. I improved my communication. I started studying up on the things that I needed to start doing instead of just reading a manual and spitting it back out. I was able to actually apply it to different situations. And so when it came time during my military career to be deployed, I was much more successful than I would have been. So there's that. Teamwork is next question. Teamwork is integral to providing care in our center. During your fieldwork placement, you'll work alongside multiple other professionals in order to help your client make progress towards achieving their goals. Can you tell us about a time that you worked as part of a team to achieve a common goal? I love sports. I played soccer pretty much my whole life. I enjoy watching it. So I was a goalie. I know that goalies need everybody else in order to win games. I know that everybody has a place on a team. But at our program here at UNE, University of New England, we just finished an interprofessional event where we had about 30 minute simulations with a patient. And we worked with nursing and PTs. And so it was a lot of collaboration between the three of us to go in. We had 30 minutes in order to take vitals, get some information, do a dressing. So the OTs kind of handled dressing with the client, and then the PTs handled transfers and moving them to their next appointment. So it was a lot of understanding when to talk, what your role was, what information you should ask about, what information you could collaborate about, and how to talk to, since it was pediatrics, how to talk to the children, how to talk to the parents. So there was a lot of coordination. And I got the chance, instead of only going once, I got to go twice. So it was very enlightening. And I really enjoyed being able to go twice to just make it better the second time. Next question, what personal or clinical areas have you identified as needing further development? Experience with improvement in patient-facing care, I think, is an area of professional growth. I don't have much. We have had some limited kind of patient time, like with simulation and such, but being able to ensure the information gets to the client, like the important information, and not just want to spend all time on relationship building, which I might want to do, because that leads into kind of a personal goal and professional goal of needing to improve my communication, just to make sure that I can be more succinct and ensure I get the correct information to the client and none of the other stuff that might distract from that important information. So yes, being succinct in my communication. Next question, what expectations do you have of your fieldwork educator to support your learning? So I really appreciate some hands-on learning. And like I said before, that live coaching aspect of it, kind of being corrected in the moment or pushed to do something else. It would be great if a fieldwork educator was helpful in that aspect, allowing me to get that hands-on experience and nearest to the event being, giving me that constructive feedback so that the next time I'm in that situation, I handle it better, I make better decisions. So yeah, muscle memory is a big thing for me. And the last question, what is the most important thing you'd like us to know about you as an OT student? So I, through a lot of experience getting, and I guess age, I am right now game to try and do anything. Like I used to be shy and passive and not, try to learn the most that I can and ask questions, but I have definitely grown in that aspect, and I just really am enjoying learning about occupational therapy and the different things that we can do to help people. And especially in neuro, I think is a really exciting area of it. So I'm very looking forward to possibly working in that setting. So, yes, thank you very much for your time, and I will talk to you soon. Thank you very much. Bye.